Right now, health is on all of our minds.
We're washing our hands constantly,
second-guessing every cough or sneeze,
and watching folks around us suffer and lose loved ones to disease while the COVID-19 pandemic is raging.
While the COVID-19 pandemic is a new health crisis we're learning to navigate, we know that for many in our community, anxieties around sickness have always been their reality.
For far too long, uninsured and underinsured folks have feared about what happens if they get sick and can't afford life-saving treatment. Poor folks have had to decide between staying at home while sick or working to pay rent and put food on the table.
Black and brown folk have been left behind by a system of doctors,
mental health providers,
and more that don't look like them or understand the health risks or the lived experiences of their communities.
We can't simply hope for a return to the normal of a pre-pandemic world where thousands of members of our Charleston community were already suffering under a healthcare system that wasn't built for them.
We must push for powerful changes to build resilient healthcare infrastructures where any person at any time can access a medical home
that provides the treatment they need to thrive.
This fall, through conversations with hundreds of community members,
we learned that too many people in the Charleston area have been denied the ability to access care,
to prioritize their physical, behavioral, and mental health.
These stories moved us first to outrage
and then into action.
In November, a diverse and passionate group of community members from our 36 member congregations and organizations came together to explore the issues of healthcare justice through research visits with providers, practitioners, and stakeholders. As we've dug deeper into this problem, here's what we've learned.
Nearly 100,000 people in our Tri-County area have no health insurance. In Charleston County, 13.2% of Black community members are uninsured compared to just
8.7% of white community members, while an alarming 39% of Hispanic community members remain uninsured. According to one study, in the course of 1 year, 28% of people who were uninsured postponed seeking care for a serious condition, compared to 5% of people who were insured.
This means those uninsured often enter the healthcare system at a more advanced disease stage,
receive less treatment when they're sick,
and suffer worse health outcomes long term.
In our state, which has yet to expand Medicaid to provide coverage to thousands more South Carolinians, we rank 44th nationally in overall health.
10 to 20% of our neighbors who make appointments in free clinics fail to show up,
likely because of the issues of access.
We heard from community members across the Charleston area related to transportation, child care,
hours, and more. And we know that even when these pockets of compassion and hard work, too many people still lack the medical homes they need.
It's clear to us that systemic problems require systemic solutions.
Many of us must decide whether to schedule appointments, surgeries, prescriptions, or treatments we can't afford.
We're being directed towards providers we simply can't reach,
whose locations require transportation we don't have,
or have hours that only overlap with work hours.
And in a healthcare system led predominantly by white folks, many Black and brown community members across the income spectrum are seeing their needs go unmet time after time.
Cultural, language, and informational barriers between providers and people of color lead to a lack of understanding that have serious implications in quality of care. We all deserve doctors, nurses, mental health care providers that know our family histories, our individual experiences, challenges, and individual health goals.
And for all of us, trying to understand the language of insurance, co-pays, premiums, prescriptions, who to make an appointment with, how to follow doctors' instructions in our everyday lives, and more can leave us feeling like we're walking in the dark with our eyes closed.
Trying desperately to grasp anything that will make our lives just a little bit better.
It's time for our decision makers and system leaders to turn on the lights.
In a community with so much abundance, it is profoundly unjust that anyone should get sick and suffer because they can't access the care they need.
It's time to make health care truly accessible to us all.
We know that to win transformative changes,
It requires all of us to be united in our call for action and organized in our efforts to make Charleston a truly life-affirming place for all who call it home.
To realize our vision of abundant and accessible care for all, we need you to join us at our annual Nehemiah Action on Monday, March 22nd at 7 p.m.
with your voice, your presence, and your passion, united in solidarity with community members across Charleston,
We know that we can hold our decision makers accountable to building healthcare justice for all of us.